Hello everyone, I'm Dr. Karthika from Department of Biomedical Engineering, SLS College of Technology, Coimbatore. Today we are going to discuss about ultrasound imaging and biomedical images in biomedical image processing. Okay, first of all, what do you mean by ultrasound? Here, ultrasound is an acoustic sound energy in the form of waves having a frequency above the human hearing range. Here, ultrasound is a way of using sound waves to look inside the human body. See here we have infrasound, acoustic and ultrasound. Here in 20 Hz we have low pass nodes, 20 kHz animals and chemistry, and 2 MHz medical and destructive, and here in 200 MHz we have diagnostic and NTE. Okay, see, here we have a basic scanner. The transducer rotated in a semicircular arc around the patient. See here, the basic scanner. See here how it looks like. The very basic scanner at the transducer rotated in a semicircular arc around the patient. Actually it was found in 1957. See here, the scan converter, it allowed for the first time to use the upcoming computer technology to improve ultrasound. See, scan converter, how it looks like. Okay, see here, the block diagram for ultrasound. Here we have main CPU and we have transducer pulse controls. It controls frequency, duration, and it can show the scan mode too. And we have transducer, keyboard cursor, and we have display unit, disk storage and printer to print the report. See here, the sound backing and piezoelectric crystals are present over here. See how an ultrasound takes place in human body. Okay, the basic ultrasound machine, it has the following parts like a transducer probe, central processing unit, transducer pulse controls, display, keyboard cursor, disk storage device, and we have printers. It prints the image from display data. Okay, then what do you mean by this ultrasonography? A diagnostic sonography, it is an ultrasound based diagnostic imaging technique. It is used for visualizing internal body structures. See, actually it is basically used for visualizing internal body structures. Ultrasonography or diagnostic sonography. And we have main imaging modes. In grayscale imaging we have A mode, B mode and M mode. In Doppler imaging we have continuous wave Doppler, power Doppler, color Doppler, duplex Doppler and pulsed wave Doppler. See, A mode, it is the simplest form of ultrasound imaging which is based on the pulse echo principle, and A scans can be used to measure the distances. A scans only give one-dimensional information and it is not so useful for imaging. It is used for echoencephalography and echo ophthalmology and ophthalmoscopy. We have a basic application in this A mode. In this B mode stands for brightness. B scans give two-dimensional information about the cross-section, generally used to measure the cardiac chamber's dimensions, assess valvular structure and function. See here the development of the B mode ultrasound image quality in 1970, 1980, 1990, 1995 and 2002. How here it shows how it evolves from 1972 to 2000, early 2000. Okay, M stands for motion. This represents the movements of structures over time. Here M mode is commonly used for measuring chamber dimensions. This is an analogous to recording a video in ultrasound. See here, it will be used to record a video in ultrasound. See the example. Okay, what do you mean by this Doppler imaging? Actually, Doppler imaging, it is a general term used to visualize velocities of moving tissues. Here, Doppler ultrasound evaluates blood velocity as it flows through the blood vessel. Here, blood flow through the heart and large vessels, has certain characteristics that can be measured using Doppler instruments. See here, blood flow patterns. We have a laminar flow and turbulent flow. In laminar flow, we have the layers of flow, normal and slowest at vessel wall and fastest within the enter of vessel. And in turbulent flow, we have obstructions disrupt laminar flow and disordered directions of flow we have. See here how it looks like laminar flow as well as turbulent flow. See the difference. The first one is laminar flow and the second one is turbulent flow. Okay, next one is applications of sonography or ultrasound imaging. Here it is mainly used for obstetrics and gynecology. Here it can be used to measuring the size of fetus, determining the sex of baby and monitoring the baby for various procedures, and it can also be used for cardiology, seeing the inside of heart to identify abnormal functions and measuring blood flow through the heart and major blood vessels. And also it is used for urology, measuring blood flow through the kidney and locating kidney stones, detecting prostate cancer at early stage. See here, we have two major risks involved in ultrasound: development of heat and formation of bubbles. It is like cavitation. And we have some benefits in this ultrasound imaging. Here the images, muscles, soft tissues very well explained, and renders live images where most desirable section is selected, and it shows the structure of organs and no long-term side effects. Widely available and comparatively flexible, highly portable, relatively inexpensive, and spatial resolution is better in high frequency ultrasound scanners. Okay. See here, while coming into limitations, we have sonographic devices have trouble penetrating part, and in here in sonography performs very poorly when there is a gas between the transducer and organ of interest. Body habitus has a large influence on image quality, and here the method is operator dependent, no scout image as there is with CT and MRI. Thank you.